Hi, welcome to Molly Vet Centre's Fear-Free Vet Visits presentation. My name is Laura Ryder. I have worked at Molly Vet Centre for over 20 years and I'm a certified professional dog trainer. Today I'd like to share with you some tips of what you can do at home to prepare your pet for vet visits, to make sure that they're nice and comfortable when they come into our care, and also once they do come into our care, what our staff do to make their visit as pleasant as possible. Okay, so first of all, it is about teamwork. There's lots of things that we can do as veterinary professionals, but it also really starts at home. So there's lots of things that you can do to help your animals start to feel comfortable about coming in and seeing us at the vet clinic. And what happens is, if we do all of this work, we create that calm, cooperative patient. There's some really nice benefits that come along with that. So first of all, there's a much more thorough and detailed examination that we can do, which means a quicker diagnosis, hopefully, and also more efficient and effective treatment, and all in a fear-free environment. So many of our staff at Molly Vet Centre are fear-free certified, so we've gone and taken further training in becoming fear-free practitioners, and we've all taken the pledge. So what we're trying to do is to make sure that when your animal is in our care, we're doing everything that we possibly can to make sure that their visit is fear-free. So we're going to start talking about some body language first. We're not going to spend too much time on this. If you'd like to learn a little bit more, we do have another presentation on dog behaviour, which delves into body language a lot further. But we're going to look at these two dogs really quickly. So first of all, we're reading body language so that we can be really fluent and understand how our dog is communicating. So the relaxed dog, we're looking for a nice open mouth, the lips are nice and long and soft, the ears are forward, the face is nice and soft, nice normal sized pupils, nice flexible neck and tail, so a nice loose body, and nice and relaxed the whole way through the body. Then we look at our little stress dog. So first of all, we start to see big dilated pupils. The facial muscles tense up, so you see a lot of tension start to build up in that face, which can lead to that wrinkled brow and tightness around the muzzle area, and those ears actually start to get drawn back as well as those muscles tense up. The tail is lower and the body lowers, and there is a lot of tension in the entire body. Now we can look at our cats. So our relaxed cats, we're looking for a nice soft relaxed face. The ears are pricked forward, almond shaped pupils. The tail is held away from the body, and the muscles of the body are nice and relaxed. Our stressed cats, so they may be hissing with their lips drawn back, the ears start to go out to the side, and this is from those muscles tensing up around the face area. The pupils become dilated, the tail becomes really tucked and held really close to the body, and the body is really crouched and arched. And again, similar our dogs and cats, our stressed animals are holding a lot of tension in their bodies. Okay, so we do get a lot of clients that come, especially I see a lot in puppy class, and they're really proud. Their puppy's quite happy for them to kind of fiddle with their toes and look in their ears, and the animal's quite tolerant, which is a great start, but we do need more than a tolerant patient, and the reason for this is a process called trigger stacking. Trigger stacking in human terms, we've all had one of those days where we've slept through our alarms, so we're running crazy late for work. We then get stuck in traffic, so that's another trigger that makes the day seem even more stressful. Work is crazy, the computer crashes, the phone doesn't stop ringing, it's one of those days. We then get home and open our mail to find a huge bill that we weren't expecting, and then the family arrive home and they all go, "What's for dinner?" And you go, "What do you mean, what's for dinner? Do you know the day I've had?" So all of these little triggers seem pretty insignificant on their own, but built up, we get to a point that we call threshold. You then get over threshold and you kind of lose it for a bit. And so the same thing can happen with our animals. So we're going to run through all of these really quickly, and then also we're going to chat about how we can possibly alleviate or reduce that trigger to make the dogs and cats more comfortable. So traveling in the car, a new environment, previous negative associations, The animal might be in pain or feeling unwell. The owner, so we might be nervous and stressed, especially if it's an emergency. The smells of the clinic, the noises, the surfaces that they come in and walk on, other animals in the area, the veterinary staff themselves, possibly the owner is not present for all of it, and then the animal may need to be restrained, there's procedures happening, they may need to wear a muzzle. So all of these are triggers that if we just had one of those triggers, the animal may cope with and be quite tolerant, but built up, we can have an animal that goes over threshold, which can then make it really hard for us to treat them. So instead, what we want to do is we want to aim for a dog and a cat with a strong positive association with handling procedures, the vet clinic, veterinary staff, all of that kind of thing. So what I'm going to talk through now is predominantly based on our doggy patients, but absolutely you can see how a lot of it you could apply through to our cats as well. So first one is the car travel. If your animal really likes going in the car and has lots of pleasant experiences going to nice places, that's not going to be a trigger about getting them to the vet. But if the only time they go in that car is a trip to the vet, you can find that that is a trigger. Before you even get out of your driveway, they're already stressed. So really important, spend that time getting them comfortable. Look at fitting them with a car harness so they're secure in there. Pop them in and out, take them for little car trips on a positive association, lots of short little trips out and about, and make it a fun event for them. We can also crate train them as well, so they can be secured in the car with a crate. And with the crate, sometimes what happens, especially with our cat patients, the crate only ever comes out when it means a trip to the vet. And those cats are clever. They very quickly pick up on that association. And again, there's a trigger and they hightail it out of there before you can even get them near the crate. So make sure the dogs and cats with their crates, they're really comfortable going in and out of it. Don't keep it, in the shed tucked away. Keep it in an area of the house where they have access to it. Make it a positive area, some comfy bedding. They can get some, treats and interactions about kind of going in and out of it and making it a pleasant experience. The next one's a new environment. So this is a big one. We think about it, the same happens to people. You go somewhere new and you can feel, a little bit nervous about it. So really important with this is that when our patients come into the clinic, that it's not a new environment for them. We want them to have lots of positive experiences with the vet clinic. So when they do come down and need to see the vet, it's not something new to them. They've been there before and have some positive things happen. So I recommend to all clients, if you're popping down, whether it be to get some worming tablets or you're picking up some dog food, or, you're driving past, you're going to the little park somewhere and you're kind of near the clinic, come and pop in, bring your dog in, let them sniff around the waiting area. Our reception staff are always very keen to give them treats and make a fuss of them and make them feel comfortable. Pop them on the scales, do a kind of, occasional little weight check and then kind of have some yummy treats, positive little experience, and then off you go. Head home or go to the little park, make it a fun little trip. So again, it's not a new environment. We're reducing another trigger for them. So this one sounds like, it's hard for us to really reduce the trigger of this. Obviously, it's most of the time why they're coming to the vet. They are in pain or they are unwell. But what I find is if we get the dog or cat used to the vet clinic, what happens is that if your animal's like a little bit off color, you're more readily going, oh, let's just pop them down to the vet and just kind of get it checked out before it escalates, before, they haven't been eating for several days. You can kind of get things checked out pretty quickly instead of the animal that you're like, oh no, I don't want to go to the vet because it's going to be so stressful and they're going to hate it. And so you put it off. And again, that animal may become sicker. So we can reduce this in a sense because we can get the dog or the cat used to the clinic, so they're more comfortable, so you feel more comfortable, they feel more comfortable about coming down and just getting a little checkup. Us owners being stressed. So with this one, it is really hard, especially in an emergency, to not be stressed, but be mindful. Our dogs are so good at reading our body language. It is super, super important that we try to take some big, calm, deep breaths and be there for them. If we get really worried, if we're really frantic, that's adding to their stress. So where possible, come take some big, deep breaths. Even if you come on your own, you can, but you feel you need some support, by all means, give a friend or family member a quick call and see if they can meet you there. They can give you some of that support to help you cope with your stress, so you can then help your animal cope with what they're going through. Smells in the vet clinic. So we use a lot of chemicals, obviously, to keep the place really, really clean. There can be smells of all the other animals as well. So our dogs especially have got amazing sense of smell, and so they pick up on lots of different things. We use a lot of this product in the clinic, so it's called Adaptil. It's a dog appeasement pheromone, and it's scientifically proven to help dogs calm. So we use a lot of the diffusers, so it's a little plug-in. We also use a lot of sprays on bandanas, and it's also available in a collar form as well. So absolutely, you could make use of this, if it's just an occasional little visit to the vet, or, what you can do is get the little spray bottle and you just spray it on a little bandana and pop it around their neck. And again, it just reduces some of that trigger of the different smells by providing them with a smell that does actually help them feel that little bit calmer. Noises in the clinic. So this one, again, busy clinics, there is a lot going on. So one thing we can do, and I recommend this, I use this a lot in my puppy classes, is the Soundproof Puppy Training app. So it's $5. You can download it straight onto your iPhone or your Android phone. And there's heaps of different noises that we can start to desensitize our dogs to. So you start it at a very, very low volume, pair it with something positive, and just kind of gradually introduce them to those noises. So heaps of things you can use for at home, but as far as in the clinic, as you can see on this one, there's grooming sounds, so there's hair dryers. There's also, because you can flick through, this is just one page of the app, there's heaps of different sounds on there. There's clipper noises, hair dryers, that kind of thing. So again, just working on that. So again, reducing triggers where we possibly can. Surfaces. So trying to keep the clinic as clean as possible. Obviously we can't have plush pile carpet in the waiting room. So we do obviously have a lot of tiled lino areas in vet clinics, which for a lot of dogs can make them feel a little bit kind of unsure underfoot. So a really good one to do is to think about bringing down a little mat for them to sit on. So that way they can, while they're waiting for the vet, sit on it. It can also make them feel more comfortable if they're being examined on the floor, or you pop it up onto the examination table for a smaller dog, and it just gives them something a bit more comfortable to sit on, and something that's also really familiar for them as well. Other animals. So this is Harry McClary's Rumpus at the Vet. It's a very funny little story, but basically the chaos that happens when there's a lot of different animals in a waiting room. So being mindful of this, we're lucky at Morley Vet, we've got the 2 separate reception areas, one for dogs and one for cats. But if you do know that your animal is a little bit worried about other animals, by all means phone ahead, let us know. We can kind of hopefully schedule you in at a slightly quieter time, and you can kind of come into reception, let us know that you're there, and then we can pop you, where possible, we can pop you straight through into a consult room, rather than your dog or cat having to sit and wait out in the general area where there may be other animals about. The veterinary staff as well. So again, back to making the vet clinic a really positive place. Do drop in, come and weigh them, come and pick up your dog food, come and buy some yummy treats for them at the clinic, and make it a positive association. So whenever you need to kind of get something from us, bring the dog with you too. We have huge big jars of yummy treats on our reception counter. So the idea is we want a real positive experience, so that those those animals start to get to know us. So when they do need to come into our care and be treated, we're a familiar face. Owner not present is another trigger that can sometimes happen with our pets. So our dog comes down into a consult room and possibly then needs to go through to the treatment room for the vets to do a procedure. And this is really common, and our nurses are out the back to give them lots of love and attention and care. But if we can sometimes help by preparing the owner so that they can actually stay with the animal and the procedure can be done in the consult room rather than going out to another area, so out the back into the treatment room, again, that can reduce the stress on the patient. So for procedures to happen in the consult room, a couple of things that we can do as owners. Number one, breathe. So, you know, if it is a bit of a stressful environment, be aware of that and be as calm as possible for your pet, because they do read our body language so well. If we're stressed, it adds to their stress. The other thing as well is at the end of this presentation, I'm going to show you a few little videos about handling our dogs at home. So some little skills that you can do at home, and it trains your dog to have positive associations with being handled, but it's also a really nice bit in that it does train us as well. So it trains us to be able to handle them and be confident. So if the vet needs you to hold them in a certain way, you know, you're really capable and confident with doing that. Then we have the restraint and procedures. So again, hold the thought for this one. We're going to do some little demos with some videos at the end of this presentation to show you how there's some really simple, quick little exercises that you can do at home, which have huge benefits because it prepares our animals for that restraint and for those procedures that they may encounter. Finally, wearing a muzzle. So this can kind of be a bit of a tricky conversation because some people kind of don't want to put a muzzle on their dog. I think it's really important for, you know, all dogs to have been exposed to a muzzle in a positive way. My guys are really good at being handled, but they've still been muzzle trained. The reason for this is, again, in an emergency, if they're in a lot of pain, if we can just quietly pop a little muzzle on them and they're comfortable with it, they can be treated a lot quicker than if they're not wearing a muzzle. So it is important to kind of get them used to it. And we do it in a really fun, simple little way. And I teach it as a little trick of basically put your nose in the muzzle and really yummy treats happens. So I'm going to show you a little video of one of my dogs wearing a muzzle in a little bit. We're going to talk about touch gradient today. So you have probably unknowingly had touch gradient done to you before. So this means when someone goes to handle you, what they're doing is they're preventing you getting the startle reflex. So if you think about a physio or a massage therapist, they will do that. They don't just kind of put their hand on you and then stop and then move somewhere else and stop and move somewhere else and stop. They actually keep their hand on you and move to different parts of the body the whole time. So they'll keep working down different parts, and this is to prevent that startle reflex. So we often do this when we're working with larger species of animals. So for example, if you've been around horses before, if you're going to go and pick up their back hoof, you're not going to go straight down and just grab that hoof. What you'll do is you kind of start on the withers. So the shoulders, you kind of work your way along, let them know you're there, then go down, and then you would pick up that hoof. So we sometimes forget this with our little species. It's easy, you know, we want to trim their nails, let's just go in and grab a foot. But if they have that startle reflex and that like, oh, what are you doing? Are you touching my foot? Oh, I'm not sure about that. We already have an animal that's kind of hesitant about being handled. So we can start really nicely with using touch gradient to start with. So for Wicker, I'm going to show you what we're going to do with his little feet. So I'm just going to pick up his little toes, have a play, and get him used to that. So we're going to go touch gradient first. So somewhere that he's used to being handled, then I'm going to work down. Yes. and he gets a yummy little treat for it. Okay, then we're going to have a work on the other side. Yes. We could also do it with our back feet as well. Boy, Wicket's wanting to do his shake hands trick. As well as that, we can also work towards the head. So instead of just looming over them and trying to go and kind of grab their face, let's say that I needed to check little Wicket's ears, I'm going to do touch gradient again. So I'm going to start here, work my way up, have a little look in. Yes. Then I might want to be looking in his little eyes, getting used for the vets wanting to kind of check him over. So again, touch gradient, starting somewhere, working up towards. Yes. We can also use it with two hands, so we can put both hands on. So let's say I need to open up his little mouth, so I could then come up, both hands on him, have a look at his little teeth. Yes. And give him a little yummy treat for it. When we're training husbandry behaviours, timing is really important with this one, and the sequence that we follow things through with. So we're using the ABCs of behaviour. So you may have heard of this before. So the antecedent, the behaviour and the consequence. And this is how we learn and our animals learn as well. So we're in the training sense of this. What we're going to do is to make sure that handling then equals yummy food. Okay, so we're going to have a quick little go with introducing Wicket now to a handling skill. So hopefully you've all got a teaspoon at home, a really simple little one that you guys can use. And this teaspoon is going to represent lots of different things. It might represent some nail clippers on the toes. It might represent some little scissors for trimming around their eyes. It might represent the otoscope, having a look in their ear. So it's a really simple one. You don't need lots of tools at home. You can start with a simple little teaspoon and build up an association. So first thing we're going to do is just to teach the patient that this equals yummy stuff. So today it's spoon, but you could be working, like I said, nail clippers, it could be scissors, it could be the clippers, any sort of little things, eardrops. What we're going to do, so with Wicket, what I'm going to do is I'm going to show him this, and then he gets a treaty for it. Yes. 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 Good boy. Okay, so we're just going to do a bit of that until you know your animal's kind of sniffing it, looking at it, being like, oh, what is this? Oh, good stuff happens. Okay, yeah, I kind of like this. So introducing husbandry equipment, always just play a game of, look at that. Look at this, good stuff happens. Look at this, good stuff happens. Okay. We have also previously done some handling with our touch gradient. So now what we're going to do is we're going to pretend with Wicket that I'm going to start using this like they were little scissors. So I've introduced the scissors. Now what I'm going to do is put my hands into the equation. Then we will combine the two. So let's see how he goes with that. Yes. 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 Okay, so you can see he's really calm. We're reading body language. He's not showing any signs that he's really uncomfortable about it. In fact, he's actually interacting and wanting to offer me tricks. So great. So once your pet has reached this, they're comfortable of just kind of, yep, cool, I'm used to being handled, we can then combine the two. Okay, so I have spoon, aka scissors today, and I'm going to use my hand as well. We're going to see how we go. So remembering touch gradient. Yes. 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 Once we've used the spoon for maybe pretending that they're scissors, you can then pretend they're nail clippers. So Wicked's done this exercise lots before, so you don't have to watch hours and hours of me training. I'm going to jump a few steps and show you what you're going to work on now. So what we've done is we've paired this equals good stuff. I've also paired me picking up feet equals good stuff separately. So now all I'm going to show you is the last little bit. So I'm going to pick up Paul, use these like they were little nail clippers. I'm just going to kind of touch his little nails a little bit, and then yes, pay him, and we'll see how he goes. Yes. 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 Boy, well done. And same thing, I'm just going to show you the last little bit, but if you have paired handling around the ears and this, you could then have a quick little go with, absolutely don't put this anywhere too close to their ear, it is metal, we don't want them shaking it, but just around the outside of their ear, getting them used to something being around there as well. Okay, so we're going to have a little go with that one. Yes. 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 Well done, little man. He's a good boy. Well done. So at least so in the video, I just used the flat of the spoon against the ear. I wasn't kind of trying to go that way, just in case they decide to wriggle or move. We don't want to, you know, hurt them. So make sure that it's just gently putting it around. Again, building that positive association. Good stuff happens when handling things occur. Milani and I are going to show you some simple little tools that we can use when we have to handle our pets. So these really are a distraction. It is a positive little association with the things that are being done to them, but basically what we're doing is we're giving them something yummy that keeps them busy while we might be trimming toenails or cleaning out their ears, grooming them, the vet's examining them, lots of different little applications. So the first thing we can use is a spoon and some yummy peanut butter. So this is one of Milani's favourite ones. So again, we can just pop a little bit on here and then we could hold it. Oh no, she's like, yes, it's my favourite. While I might be brushing her, I could be cleaning out her ears, I could be trimming toenails. Obviously, you may need someone else to hold this though, if you need both your hands to handle them. But a really simple, nice one. Bathing them, you know, you can have this and be kind of washing them with the other hand, or if you've got another pair of hands, make the most of it. Get someone kind of loading up the peanut butter and letting them go and lick and enjoy it while you're kind of introducing, you know, the bath to them. Was that delicious, Milani? Yes, good, good. Okay, the next one is our snuffle mat. So it's a rubber mat, you can see on the back, with polar fleece on it. The idea is we don't use peanut butter for this, we're going to use dry food. So we're going to load it up with some, oh, freebie over there, Milani. We're going to load it up with some little dry treats. And again, you could see she's sniffing and snuffling and she's kept busy, while again, I could be picking up her feet and trimming her nails. I could be getting some ear cleaner, wiping out those ears. I could be brushing, grooming. Again, really positive association, you know, like yummy stuff is happening, and we're kind of distracting them, keeping them busy and in one spot. And a really nice thing about the snuffle mat is you have both hands free. You don't have to be feeding food as you go. It's there preloaded. You've got both your hands free to do the handling. All right, Milani, your last one, sweetie. Okay, last one, Milani, this one. Okay, so these ones, oh, she's going to finish off the snuffle mat while we chat, and the peanut butter. Okay, so these ones are our licky mats. So these are just pot holders that you can get from any of your kind of little department stores. And what we're going to do, my go-to is I use little baby food sachets. So what we're going to do is squeeze some on here. Oh, I know, Milani, this is another favourite of hers. And then I'm just going to kind of squish it and squeeze it a little bit. And hopefully you can see it's kind of gone into all the little grooves on there. Alright, so we're going to see if Milani wants to come and check this one out. Milani! Oh yeah, there you go. Alright, so you can see her. There you go. Okay, so this is going to take her a few moments to lick and drool and slobber all over it and enjoy licking up all of that yummy food. And again, I've got two hands free for this, and I could be brushing, I could be looking in ears, trimming nails, doing any sort of little husbandry techniques that I need to with them working like that. Okay, so hopefully that gives you a few little ideas, nice simple ones that you can introduce to your pet. Yes. 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 Good boy. Yes, good boy. Good man. Yes. 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 Sorry. Yes. 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 Yes.